Has anybody seen a patient like this? Is this a new position for ARDS, like a reverse prone position? So this is actually extreme form of tetanus, and the situation here is because of hyperextension. However, not all patients of tetanus are like that, most are like this. It is characterized by the earliest symptom, which is lockjaw. Patient is unable to open the mouth because of increased tone in the masseter muscles, and generally there will be increased tone all over and legs will be hyperextended. The patient also gets frequent spasms and there is laryngospasm as well as autonomic dysfunction. These are the clinical features, and one has to be really vigilant in the diagnosis at times because there is no clinical clue to the diagnosis, and this disease occurs because of injuries, and injuries transmit the Clostridium tetani bacteria to the patient through the injury. 25% of the patients don't remember any injury and there are only minor abrasions, and Clostridium tetani bacteria are widely prevalent in the soil in the rural areas. The bacteria is like a drumstick as seen here. It's anaerobic and it's gram positive and it's very difficult to culture it, and the bacteria releases the toxin tetanospasm, which goes into the peripheral nervous system and from there into the central nervous system and causes all these neurological changes. The sensorium remains normal and the differential diagnosis includes certain poisonings like strychnine or even dystonic reactions to certain drugs. There is no diagnostic test. Diagnosis is clinical. If the patient is unable to open his mouth and has hypertonia in the body, always think of tetanus, especially if there is a injury. And the mortality can be high, up to 25% in severe cases. The usual course is 4 to 6 weeks. Why? Nobody knows. So early tracheostomy is recommended in these patients, especially because they can go into laryngospasm. As far as the other factors are concerned in treatment, apart from tracheostomy, one has to give antitoxin, which is available as human or equine forms. Little is injected into the wound and rest is given to the body. And you give esmolol to control autonomic dysfunction as well as metrogyl and sedation for the patients, and magnesium.